Hey, Dr. Tyler Williams with Pinecrest Dental. Thanks for joining us for today's video. You're here because you have some questions on snapping implant dentures, or maybe you have a denture that's not staying in or fitting well, and you're interested in some upgrades and some better options for that. And that's a reason that a lot of people come and see us, is because they want to get a new or better smile, and they want to make it functional, affordable, and really work better than a denture. So a couple key things to keep in mind is that a denture chews about 10% as well as real teeth. So if you had all of your teeth in your mouth and you took them all out and you got dentures, especially on the bottom where they chew the worst, lower dentures, you're going to get about 10% chewing function, which means you're probably not going to be able to eat steaks or salad or carrots or corn on the cob, those kind of things. There are some rare exceptions to this, but most people cannot. If you compare that to getting full mouth implants where they're screwed in, you can probably get 9 to 10 times better than a denture, pretty close to what your real teeth would chew at. But what if you don't want to put that kind of money out? You don't want to buy a luxury car. You don't want to spend that much on your teeth. Then snap-in implant dentures might be the option for you. Also, what if you want to be able to clean them easier and take them out and have more control over them? Snap-in implant dentures could be the right thing for you. If you want to have them more easy to repair or maintain, then snap-in implant dentures can be the right option for you. They'll usually chew about 3 to 6 times as well as a denture. Okay, so can you eat apples and corn on the cob and carrots? Probably. But can you eat them as well as real teeth? Maybe not, but much, much better than a denture or missing teeth or a loose partial bridge that you might be wearing right now that you hate. So a couple other things to keep in mind, some of the benefits is they're going to be much more secure than traditional dentures. All right, you're going to have better chewing ability. They're going to look more natural. Okay, so one thing our patients love about snap-in bridges is they look much more natural and they stay in better. Second thing is you can speak better, right? Because most of the time it doesn't have to cover the roof of your mouth. We can make it like a bridge shape, right? Speaking, eating, tasting are improved. Make sure that when you're doing this, you're working with someone who understands how to do that and that you have a stronger material for it. Because if you are using regular denture material, your cutting and chewing efficiency may not be quite as good. Some offices will just make them out of regular dentures or convert your regular denture. You're not going to get as good of chewing or eating with that. You want to have an upgraded, improved acrylic with some composite reinforcement, or one that's 3D printed or milled to get a better, stronger, smoother, natural look. Okay. Maintenance with these is the third thing I want to cover. You take them out a couple times a day. You brush them just like you would your teeth, and then you brush the implants, and then you pop them back in, right? You can do that in the restroom, between meals. You can do that at night before you go to bed or when you wake up in the morning. Are all good times to do that. Cost considerations. Okay, a lot of people ask about that. You're going to be anywhere from a third to a half as much as full mouth implants. Okay, so think about this like buying a car. I referenced that earlier. Okay, so your full mouth implants, those are going to be like a luxury premium vehicle. All right. All dentures are going to be like your jalopy, your car that runs, but it kind of sputters and it makes some noise. And even though our newer dentures look better, right, the chewing ability has not improved very much on them, simply because the limitations of they're not attached to anything. Okay, so when you look at snap-in implant bridges or dentures, you're going to be somewhere in between those two. Okay, so you could be anywhere from a few $1,000s to maybe close to $30,000, right? Just depends on which options you choose and where you're at. So it's important to find someone to meet with you're comfortable with, and they can present you with an option that's going to help you reach and meet your goals. It's a lot of fun for us to help people succeed in this area, right? Potential drawbacks I mentioned would just be, you're not going to have 100% chewing ability. Okay, so if you have a full set of teeth right now and you feel like you're chewing pretty well, or maybe even if you're missing 4 teeth, 4, 5, 6 teeth, you're still going to chew better than you would with a snap-in implant bridge denture. Okay, so I'll say that again. The human mouth usually has 28 teeth if you take out your wisdom teeth. Okay, if you have 16 to 20 teeth, those are probably going to chew better than a snap and implant bridge denture. Okay, now your mouth may not be healthy. So the nice thing with the snap and implant bridge denture is your mouth is going to be healthier, your smile is going to look better, and you are going to be able to chew. But it's going to take a little more time to retrain your mouth on chewing and eating, what that's like. So if you have some more questions on this, please reach out to our office. Our contact information is below. We'd love to help you with this, and we hope you have a wonderful day. Thanks for checking out this video.